So we're going to talk about care of clients with physiological adaptation needs and alterations in body systems. There's some normal fluctuations in temperature that we need to be aware of. Body temperature tends to be the lowest early in the morning. It peaks in the late afternoon, and then there's a gradual decline during the night. If you think about it, when you have a temperature, you have a fever, it's going to be the worst in the late afternoon into the early evening, and then it declines during the night. It's the lowest in the morning. So we need to be aware of that when we're taking temperature. That's when we expect it to be the highest. And so we need to think about that when we're taking vital signs and we're looking at graphs of vital signs. As far as blood pressure, we know that it's the lowest when a person is sleeping. It's going to be the highest in the afternoon, and it decreases in the evening. The increase begins about 0400 to 0600. So that's when we expect, just before 4 a.m. is when we expect that blood pressure to be the lowest. As far as temperature, when we're looking at a person's fever, fever is more accurately assessed between 5 p.m. and 7 p.m. That's when we expect that fever to be the highest. And as far as blood pressure, we expect it to be the lowest at just before 4 a.m. Blood pressure can drop 10% to 20% during nighttime sleep. So we expect to see that kind of a drop. Clients' meds or treatments can influence vital signs such as cardiac drugs, which can affect blood pressure or pulse rate. Anti-inflammatory drugs and steroids can affect temperature, warming and cooling blankets, or fans. Any of these things could affect a person's temperature by causing it to be either lower or higher. If you have a fan blowing on somebody, it's going to actually cause their body to cool off. If they have a warming blanket on them, it's going to cause their temperature to go higher. A cooling blanket will cause their temperature to go lower. So all of these things could affect the person's temperature. If the person is on a vasodilator, remember that vasodilation causes lower temperature. Vasoconstriction causes higher temperature. So those are going to cause effect. Antiarrhythmics, cardiotonics, antihypertensives, all going to affect blood pressure and pulse because of the constriction. So any of those things could affect your vital signs. Exercise, anxiety, and pain will all affect your patient's vital signs. Anxiety and pain are going to affect pulse and blood pressure. Exercise will affect pulse and blood pressure, and also respirations. Things that interfere with the factors, the accuracy of vital signs. If a person has been smoking or has had a hot or a cold drink, you're not going to get accurate temperature, and you need to wait about 30 minutes after they have had any kind of oral fluid intake or hot or cold food in order to get an accurate temperature. Also, caffeine or nicotine will affect your patient's pulse. So that's going to affect it. Talking will also affect the accuracy of your vital signs. And not only your temperature, but also your blood pressure. So you want to be aware of that as well. As far as abnormal temperatures, let me go back. I want to go back to the previous screen real fast. When we're talking about caffeine or nicotine, they increase the pulse rate. Coffee increases blood pressure within 15 minutes and can last as long as 3 hours. Blood pressure and pulse rate are immediately increased by smoking, which lasts as long as 15 minutes. And talking to a client when blood pressure is being assessed increases the readings by 10% to 40%. So you need to be aware of that. A client has a 1 degree Celsius or more above normal range. If you see that, then you want to assess for additional data that suggests infection. So you want to look at things like, do they have systemic evidence of a fever, or do they have local evidence of a fever? We want to reduce external covering to promote heat loss, because we don't want shivering. Administer antipyretics and antibiotics as ordered. If they have a temperature that's 1 degree Celsius or more below normal, if they have wet clothing on, we want to remove them. Close doors or windows, eliminate that. Drafts, turn off fans. And monitor apical pulse rate and rhythm, which could be important. If the temperature is above normal, if it persists or reaches an unacceptable level, as defined by the physician, usually you'll be given parameters. Administer antipyretics or antibiotics. If it is low, below normal, monitor the apical pulse and rate. Hypothermia can cause bradycardia, cardiac arrhythmias, and electrolyte imbalance. So we want to monitor for those. If the pulse is weak, thready, or difficult to palpate, make sure that you're assessing both radial pulses on either side and comparing your findings. You may have one side that has a blocked or occluded radial pulse, so it may be weak only on one side, so make sure you check both sides. Also assess for swelling in the surrounding tissue or any encumbrance, something that may be impeding the flow. So always going to check that to make sure that it's not simply the radial pulse that's the problem. It could be something like a dressing, tight clothing, something like that. And then observe for symptoms associated with altered peripheral tissue perfusion, like pallor, cyanosis of tissue distal to the pulse, and cold extremities. If you have a client with a pulse greater than 100 beats per minute, auscultate their apical pulse. Anytime you have a problem with your radial pulse, there's anything that's abnormal about your radial pulse, you're always going to go and take an apical pulse, because your apical pulse is your most accurate. You're going to identify any related data. Are they in fear, pain? Have they been exercising? Do they have blood loss? Is there any reason for this pulse to be high? Then you're going to observe for symptoms associated with abnormal cardiac function, which could include dyspnea, fatigue, chest pain, orthopnea, syncope, palpitations, any unpleasant awareness of the pulse, jugular vein distension, or JVD, edema of dependent body parts, cyanosis, or pallor of the skin. So any of these things could indicate that there is a problem with the heart. If the client has a pulse that's less than 60, again, auscultate the apical pulse. Observe for factors that may alter heart rate irregularity. Assess for pulse deficit. Remember, that's where you're taking a radial pulse in conjunction with an apical pulse, 2 nurses, and you take it at the same time and see what the difference is between the two. You may need to withhold meds until the doctor can evaluate the dose. Things like digitalis, anything that causes a slowing of the heart rhythm, you want to hold those medications. Any cardiotonics or antiarrhythmics, you want to hold until that pulse rate has come up. And for irregular pulse rhythms, always auscultate your apical pulse and identify what the pattern of irregularity is. and you're going to assess that pulse deficit. And there's a possibility that the patient could need an ECG, or they may put them on a Holter monitor. And that would be per physician's order to detect any heart abnormalities. Abnormal respiration rate, of depth or pattern, or if the person's having dyspnea, complaining of feeling short of breath. Observe for any related factors, things like obstructed airway, noisy respirations. Do they have any cyanosis in places like their nail beds, lips, mucous membranes? Their skin, are they irritable or confused? Do they report shortness of breath? Do they have a productive cough? Abnormal breath sounds? Is this possibly the effect of anesthesia or meds? We want to get these patients into a sitting position, semi-Fowlers or high Fowlers. You can also bring the bedside table to them and have them rest their arms on the bedside table, and that can often help them to breathe because it opens up the chest and allows them to use their auxiliary muscles to breathe. It improves their ability to take a deep breath, and that can help them to breathe better. If we're evaluating blood pressure, and the blood pressure is above acceptable ranges, the diagnosis of hypertension involves 2 or more elevated readings on separate occasions. So if we just take it once and it's high, that doesn't mean they have high blood pressure. It simply means they have 1 elevated blood pressure. So we recheck it or have another nurse recheck it in 1 to 2 minutes. Verify your size and placement of your cuff, because if you're using too small a cuff, you're going to get a high reading. If you're using too large a cuff, you're going to get a low reading. So it's always important to verify the size and make sure that the cuff is on correctly. If it's not on correctly, it's going to give you an incorrect reading. And if we have a high reading on the blood pressure, do they have any other symptoms of high blood pressure? Things like headaches, which are usually occipital headaches, flushing of the face, nosebleeds, fatigue, anything that could indicate to us that that person has elevated blood pressure as well. They might have a ringing or pulsing in their ears, things like that could indicate that their blood pressure is high. Now, if their blood pressure is low, we only consider a person hypertensive if the blood pressure is not sufficient for adequate perfusion and oxygenation of the tissue. So we compare it to their baseline. If their systolic reading of 90, it can be acceptable value for some and cause no ill effects. So we only consider it hypertensive if they have symptoms. So observe for symptoms related to decreased cardiac output, like tachycardia, weak thready pulse, they're dizzy, confused, they have pale, dusky, or cyanotic skin, cool or mottled skin over the extremities. Then we would worry about hypertension. Then that would mean that they are having a problem. If they're not symptomatic, then we don't worry about the hypertension. If their blood pressure is inaudible, so if we determine there's no immediate crisis present by obtaining respiratory and pulse rates, then we can use an alternative site or procedure to obtain the blood pressure. We may have to use the Doppler to obtain blood pressure. Maybe we'll auscultate in the lower extremities using a thigh cuff. Make sure that if you are auscultating in the lower extremities, you are using a thigh cuff, not another cuff, to try to get that, because you want to use the cuff that's made for the lower extremities. And implement palpation method to obtain a systolic reading. We can do that as well. So if we can't hear their blood pressure, then we may have to use a Doppler, some other form of or method to get that. Temperature is usually lower for geriatric patients. A higher threshold for sweating at high temperatures, and their diminished sense of